Awesome.
I'll find out what the issue is. Thank you. Sorry for that.
Hello, everyone. Thank you for joining us for this conversation. As you can see, we have a panel of experts and who are going to go into this topic, domestic violence, gender-based violence being on increase globally, not just only in Kenya or in Africa. It has been it's been increasing globally. And so we are going to get into this conversation. But before we get into that conversation, I am with my co-host, Juliet Kimoto from PAWE, who is going to introduce our panelists.
All right, welcome all to this amazing webinar. And if I could introduce our panelists, the first in line is Commissioner Priscilla Nyokabi.
Thank you.
The Commissioner in the National Gender Equality Commission in Kenya. Priscilla, please wave so that everyone can.
Hi. I know Teresa.
Hi, Priscilla. Nice to meet you after a long time.
All right. Next panelist is Teresa Omondi Adeitan.
Hi, everybody.
She's the Deputy Executive Director at the Forum for African Women Educationists, FAWE, Africa. That in line is Mr. the only gentleman in the room, Sam Noga. He's also the Executive Director of the Plan International African Union Liaison Office. And then we have, last but not least, I use in particular, Wawira Nyaga, a program officer at the East African Civil Society Organization Forum, the Kenyan chapter. Welcome all.
You forgot Nyarazai.
Oh, and then there is, sorry about that, Nyarazai. And we have a very powerful lady in the room. Her name is Dr. Nyarazai. And I really try not to pronounce the second name because every time I
the rest is sexy, Juliet.
Yeah, and the powerful lady is the current African Union Goodwill Ambassador on ending child marriage, and she's also the founder and chief executive officer of the Rosaria Memorial Trust. Welcome, Nyarazai.
Thank you so much. I think, thank you.
So, in fact, we are going to start with Nyarazai, and I just want you, because you have a more global picture of what we are talking about, domestic violence, gender-based violence, and I just want you to speak on from where you sit at the AU, how does it look like?
We are in a crisis. The crisis we have is that COVID-19 is also a crisis of gender-based violence. And this has already been pronounced both by the United Nations. We saw the UN Secretary General issuing a statement on this, and equally for the African Union. And for me, it is also a crisis for girls and a crisis for young women, especially in Africa, where we are now experiencing schools are closed. It means people are at home. And at home, we are on lockdown, which means livelihoods and hunger, and at the same time having to live at times in environments, home environment, which can be where people might be experiencing violence. So this is a crisis that we have of gender-based violence, and we need to continue to see that the responses that we have is taking a very strong intersectional approach so that violence against women is part and parcel of the health response, it's part and parcel of the social protection, a livelihood response, and it's part and parcel of the human rights response that we are calling on governments and many of the partners. I see it every day here in my village where I'm logged in, and even much more is that those who have technology and access to communication are privileged. As you can see, I'm not able to do internet-based connectivity, but only phone. And I'm even privileged to have the phone. There are many who are really out of any communication and are experiencing violence and need our support.
Thank you so much, Nyarizai. As you say that, I saw that before someone else jump in, like what forms of violence are we seeing in this season?
We have maybe 5 big forms of violence. One is when people are traumatized, because we are now a traumatized community. We have psychological violence that people experience when they cannot find food ordinarily. People tend to be snappy with each other. Domestic violence, which is battering, actually fist fighting in the home. That is an experience that we're having. There's a lot of cyberbullying, cyber violence, because people are pushing off that pressure using the platform for technology. And we're also seeing violence in the public space. And that at times is so much violence against women. For instance, when the police is trying to enforce social distancing, the majority of the women on the market, of people on the market, are women. And so that is a form of gender-based violence, because it means women are targeted because of their productive roles which they are playing within society. So it ranges from the intimate, I don't like the word intimate. When you are intimate, you should not violate each other. So we have experience of family violence, community violence, public violence, and also psychosocial violence that we see. And hidden in all that is the violence against girls and young women. And we are so worried of the issues of sexual exploitation and the issues of child marriage that can even just become much more visible after the lockdowns and the crisis.
Thank you so much. So as we join in, I want Wawira, I want you to jump in and talk to, you see that we say there are different forms of violence and they're happening in different ways. Like, how is that impacting our society? How is that impacting our society?
Yeah, let me start by talking about how the GBV, when it's impacting, especially the youth. Let me talk about the youth first. We've been in contact with a few organizations that are on the ground in areas such as Korogosho and Madare, and they're talking about how, like, because they're not able to work at the moment, they're not able to access different resources. They're just in the house, and they're right now they're abusing a lot of drugs at the moment. I'd say like the first impact, of course, of that, it would be psychosocial, and mental frustration, anxiety, all that. And in the end, at the long run, it also makes it increase, and it increases the anxiety for people. And at the end of it, it also leads to further abuse. When you're looking at cases in now those slum areas and areas where they're not able to access these resources, for example, let me talk about the physical abuse that has been going on by policemen. Yeah, the police brutality, especially when mothers and even just people are trying to rush to the hospital or trying to rush to their houses, and they're caught up after the curfew, for example. And you find that some cases have been reported where people have lost their lives, that's one. And in other cases, people have lost their children on the way, if they're women and mothers. In other cases, people have lost their relatives, their children. And it, of course, now that's another effect, is the loss of, lives, and which is ideally death. I'd say another Another impact that is probably being seen around is, let me give an example of the cyberbullying that Nyarazai has mentioned. Recently, just about last week or last week part one, there's a lot of trolling going on about a young lady on social media who had just posted a video of herself, taking time and using the social distancing on social media. And there was a lot of trolling going online. And, we need to discuss about just not having that abuse, acknowledging the fact that cyberbullying and cyber harassment and also things like hacking during the different webinars that are ongoing or even classes by university students, that it may also lead, it is a form of violence in itself. Yeah.
All right, thank you, Awira, for that. And we are all coming at a time where the current response structures of gender-based violence are on trial, in the aspect that GBV falls solely on the mandate of the Ministry of Health to be able to address it, intersectoral ministries, including ministries of gender, ministries of education here and there. And, at this time when all resources of most countries in Africa are really geared towards trying to mitigate COVID-19, it begs the question, are the countries ready to really balance the attention of attending to these emerging issues such as the GBV, and also being able to remain consistent in addressing the COVID-19 widespread in country and both at continental level? And I would like to ask Commissioner Nyokabi, do you really think the government in Kenya is really able to strike the balance and it's able to address these emerging needs, such as the GBV, tackling GBV in the country, and what really needs to be done to be able to address GBV, even though we are still battling COVID-19 on the other hand, rather?
Thank you. I think it's indeed true that COVID-19 is a challenge for everyone and is a new challenge that the country has to deal with. And most of the measures for both genders, really, they are gender blind, that a lot of COVID-19 measures have been put in place for the entire population. But here in Kenya, what we have seen is the Ministry of Gender, the Minister of Gender in particular, after the highlighting of the GBV concerns, the National Committee, the National Coordinating Committee led by the Ministry of Health, has already admitted that gender is an issue and GBV cases are an issue and GBV cases are rising. So already the National Coordinating Team and Mechanism has admitted that GBV is an issue. And we are happy that among the membership of that committee, we see quite good representation of women. I think they could have done more, maybe by having more ministries. I'm not sure whether the Ministry of Gender is a direct participant in the National Steering Committee for the COVID. But so the National Committee has already admitted their gender concerns. And I like the questions Wawira was raising on welfare. So we have a lot of welfare measures now for vulnerable households, including the cash transfers. Well, the fear is that sometimes when there is money to caregivers, if those caregivers are women, they are now also at new risk within the family households. But to the extent that there is an effort towards cushioning the vulnerable families and direct cushioning for that matter using electronic ways of sending money, I think that has been good. The other thing that has happened, which is what I was going to with the Ministry of Gender, is the hotline number that we have always had on GBV cases. So the Minister of Gender has really been out there reminding people that we have a hotline number for the purposes of recording GBV cases. There are people who feel that with the COVID, we are suspending the laws and the constitutions and the human rights standards that we have always had. And I think, and I have been happy at some of the people who are insisting that the law has not been suspended. The Kenya National Commission on Human Rights has gone out on educating people. You know, our first curfew night was really a brutal night. We saw police brutality in a manner we haven't seen in the last, since the new constitution. So there is a new intervention. In fact, the joke in our circles here is that law should be an essential service. that they forgot to put lawyers in the essential services list for the purposes of fighting some of these GBV issues. And maybe those are some of the concerns that we could pick on. If GBV continues to be an issue, then the enforcement agencies that have always worked with GBV might need to be part of the essential services. But the hotline number is there, and the minister keeps making information around existence of that hotline number and use of that hotline number, and the human rights standards back on the table, even as we discuss COVID. And those human rights standards are what would protect women from GBV. I think the part that is still not resolved is what to do with the domestic sphere. We had passed the Domestic Violence Act here in Kenya, which unfortunately has not been implemented. And we may need to go back to the conversation on implementation of the Domestic Violence Act, even amidst the COVID, because now COVID has introduced new dimensions on domestic violence that might need to be looked at. But in essence, looking at the National Steering Committee, the Ministry of Gender, the counties have the county committees. Our own commission, the National Gender and Equality Commission, is in conversation with the Council of Governors on having gender-related and gender issues as part of what the counties are going to look at as they prepare for their own COVID situations. And you know, our COVID is moving to counties. Our cases now are more in counties than we had seen before. So there's a conversation pending there, what the counties and the Council of Governors is going to do in as far as gender issues is concerned. It has a gender committee. The Council of Governors has always had a gender committee, actually led by a male governor. And so that will be the other level to see. So essentially in Kenya, while COVID is an issue, I think it is on the table that GBV is also an issue that needs address even as we address the COVID.
Thank you so much, Honorable Nyokabi. So this question, I will start with Nyarizai, and then Teresia, you can jump into this question. So here we are talking about two levels of violence. For me, I'm looking at violence that is not being beaten at home. You know, I know Nyarizai, you are very passionate about this, about child marriage, about FGM. So what are you hearing about this? Because now 400 million children in Africa are at home. You know, they're not going to school. And, you know, our school is the first line of defense against FGM and child marriage. So can you speak a little bit more on this? And then, Teresa, you can jump in.
Thank you. COVID-19 is the tip of multiple crises. And unfortunately, the abuse of rights through some of these negative norms and practices are not stopping because of COVID-19. So we still have people who are predatory, who are abusing children, who are abusing girls. We still have that as a crisis. The major challenge at the moment is that the issues of girls like FGM and child marriage become overshadowed by the COVID-19. And therefore, I'm looking at my mandate and the work on ending child marriage, and where we are coming together as partners to say we need to sustain the campaign to end child marriage. We need to sustain the campaign initiative to end FGM as a continental initiative, and to look at those campaigns and position them within the context of COVID-19, because we know that with COVID-19, the world is no longer going to be the same. 400 million children not going to school is not an anecdotal number. This is huge. And even when the schools open, we may have many children, many girls who may not go back to school again and who are at even greater risk because our economy is now fractured, because the informal sector is now fractured. Therefore, they may be looking at marriage as a way out of poverty. So it's critical that as we address the issues of COVID-19, we need to look at the invisible but critical forms of gender-based violence, like child marriage, and integrate prevention messages into the existing responses that we have for prevention. Also, we need to look at when we say our governments must adopt social protection measures for the most vulnerable. What are those social protection measures that must be in place beyond hunger, beyond just food? So for me, those social protection measures must equally be addressing issues of prevention of gender-based violence and providing emergency response and rescue to girls at risk.
All right. Thank you so much, Dr. Nyaradzai. And, I'd like to pick your line of thought in terms of what kind of measures, social protection measures that need to be in place beyond even COVID-19. Because if you all remember, Ebola was also another pandemic in the continent. And COVID-19 is also taking the same footsteps in terms of really having so many of us, Africans and even beyond Africa, losing their lives and losing the lives of their beloved ones, and also, total destruction. And it begs the question, how well are we always prepared as governments, as civil societies, as individuals, in ensuring that we have this long-term solution, long-term investments to be able to be prepared and tackle this particular pandemic? And I'd like to pose the question to Sam. What kind of investments do we really need on the ground to ensure that we are always prepared beyond the current scenario, and obviously ensuring that should there be any other pandemic similar or non-similar to COVID-19, we are well placed to address it and limit the casualties and the damage that we cause to the society?
Thank you very much, Juliet. And I think I would want to reiterate some of the issues that have been mentioned earlier on by Warari, Arira, by Nyaradzai, and also the Honorable. I think one of the things we continuously see is the fact that most of our interventions are really short-term. They are reactive, and sometimes they don't position us to look at what happens in the long term. And so I think for me, what I'm looking at is what are the long-term measures beyond COVID. I mean, COVID definitely will pass, but the issues that girls go through, the issues that adolescents go through will have to be addressed with the long term in mind. I think we're looking at a more comprehensive approach, a more holistic approach to addressing these issues, and especially for issues that are endemic in our societies. If you look at the origin of gender-based violence, it's not something that is only starting because of COVID. It's something that we've lived with. It goes to the issues of some of the harmful practices that we encounter. It goes to do with power. It goes to do with access to resources. So it goes beyond COVID. And I think if we need to resolve this, we need to invest in a range of areas. I would try to identify a few of those areas. I think the first area we need to invest in is our legal framework and legal systems. We have a lot of laws, we have a lot of legislations and policies. I think the question has always been, and would always be, how do we invest in the implementation of those policies and those legislations? So it's about investing in the policy framework. It's about investing in legislation, making sure that those who have been tasked with the implementation are also resourced for them to be able to provide a framework for which we address those issues. And I think I like the fact that we are recognizing that COVID hasn't taken over the other societal issues. I mean, the issues are there. COVID is being prioritized, but it doesn't mean that we relegate into the background the other issues that face children. I think that is where we have to increase our awareness and also increase our responses to say that, yes, we are in an emergency situation, but it doesn't mean that the issues that affect girls and women have been dealt with. I think we also need to invest in our response and reporting mechanisms. I mean, that is something that we haven't really invested in. the Honorable was talking about helplines. Sometimes the helplines are not available. Not just available, but you don't have short codes that are short enough for people to be able to phone in. I've seen emergency lines in some countries, including my own country, Ghana, which is your 10-digit number. How does somebody phone in for a 10-digit when they are in a crisis? So I think we need to improve on our reporting, invest in our reporting. I think we need to look at the whole social structure. Yazai talked about rescue centers. How many countries have fully functioning rescue centers where you can actually put somebody in case they are in a situation where they've been violated? And I think gender-based violence would have to have systems, societal systems, social systems that support them. So investing, again, like I said, this is not just for COVID, but for the long term, investing in rescue centers, investing in social protection mechanisms, making sure that our societies have the capacity to be able to respond and not always waiting for governments. I think one of the things we've seen with COVID is our frontline first respondents. And I think we can adopt the same approach to gender-based violence, where we have systems in place that are able to respond immediately and rapidly if there are cases of gender-based violence. I think the other area I would want to also touch on is the whole issue of economic. We know families have lost income. We know families have lost revenue and opportunities for them to generate income. We cannot address gender-based violence if we are not also empowering communities and families to be able to provide the basic needs. And sometimes the people who are the perpetrators are also the breadwinners. And so if we are not empowering women economically for them to be able to be independent, then what you see is people stay in those abusive relationships because they're dependent on the same perpetrator. So for me, one of the areas we need to look at is how do we strengthen economic opportunities for women. With gender-based violence also comes the whole issue of, I think Nyarajai mentioned, psychosocial abuses and sometimes physical, which goes in part on people's mental health being. So again, how would we should be investing in mental health being of people who have been violated. We should be providing psychosocial support and immediate support and appropriate support for people who have been violated. Earlier on mentioned reporting. I think we need to strengthen our online platforms. I know it's not always everybody who has access to, but we can also diversify. So it's not just access to helplines, but also we should create online platforms where people should be able to report if they have such cases. The other area I would want to talk about briefly is also expanding the reach of those services. Sometimes the services are only available in your first or second level community. And I think we need to make sure that the services are available at all levels, and especially working with traditional leaders, with religious leaders, strengthening community-based child protection mechanisms, making sure that they are functional, but also resourcing them to be able to respond when we have such cases. So I think these are definitely beyond what we do on a day-to-day basis. I know the African Union currently is working on the new campaign on ending child marriage. I know there's also the campaign on FGM. Those are some of the continental platforms which can be used to make sure that we are holistically addressing the issue of gender-based violence, but not just addressing them, investing them. Question probably will be how much are government investing in social protection, in making sure that people who are violated are able to have some form of respite. And I think for me, that is what I'll look at in terms of how do we address this. And I think also for the organization I'm working with, which is Plan, we are investing not just in the short term, but also in the long term, and making sure that we are bringing all the relevant ministries, line ministries but also agencies, including CSOs and NGOs, onto the platform. Thank you, Juliet.
Thank you so much, Sam. We really, really appreciate that. You know, before I know you're leaving for a meeting, but before you go and before Teresa comes in to tell us how to access justice, you've mentioned about the economical impact of COVID-19 to women and girls. So, Nyarizai said that this crisis has different levels. You know, it has different levels. Can you just expound a little bit on the economic, and what does that mean to the girl child? A 5-year-old girl who's growing up in this season, what does that mean, the economic impact of COVID-19 to the girl child?
And if you look at the economic structure of most African countries, what you have and where we have most of the vulnerable women working, not the informal sector. Within the informal sector, what they do is they sell today, that's the money they use to buy food. So when you have a lockdown, and we're not saying government shouldn't lockdown, I mean, of course, we need to balance between containment of the virus, but also the livelihood of families. Now, in societies where you have single parents, most of who are women, I mean, once you have a lockdown and you lose the loss of income and economic opportunities, now that goes a long way to affect not just the children, but particularly the girls, and especially in societies where if there's not enough food, the person who eats first will be the boy and not the girl. So what we've seen increasingly is, and I think Nyarazai also mentioned, is that families are already looking at coping mechanisms, and some of the coping mechanisms are not positive. Some of them are very negative and retrogressive. And what we've seen through the work we're doing is that there's upset in child marriage because you've lost income. I mean, the only available resource you have, and I'm saying resource carefully, is a girl who can be married off. I mean, one, you take them off because you don't need to care for them, but two, it also brings some income, unfortunately. So those are some of the challenges we see. So there's an increase, and these are cases where they have been reported of girls who have been forced into marriages because, like you yourself said, they are not in school, which is the first line of support and also preventing girls from being married. So that is the impact. But again, it also has long-term impacts because if families cannot provide for their children, it also means that once COVID is over and the impact of COVID is probably going to live on for many months to come. So then girls are not going to get into education. I mean, out of the 400 and something plus million who are currently out of school, and if we take that probably there's a parity, so 50% are girls. Now, what we are saying is that not all those girls will end up, unfortunately, back into school. So just for closing schools and for loss of incomes and for loss of economic opportunities, including companies that have laid off staff. And I'll give a good example. If you take the hospitality industry, I mean, most of the cleaners, and we're talking to somebody who is a cleaner, says they're the first people who are laid off. So if you lay them off, they're not working, they're not able to provide for their families. Some of them then end up with spouses who they probably have moved away from because they could cater for themselves. Now they have to go back to those same abusive spouses. So I think it goes beyond just the girl child. It affects every fiber of the community, both in the short term because of the impacts the short term, but also in the long term. We find that most girls will be out of school, they'll be married, they'll be cut, and that is because families will see that as a coping mechanism, which negative in a sense, but I'm sure the options between what's available for them to do. I think in terms of response for that, what we are also looking at, and like I said initially, is how do we invest in women? How do we give them skills for them to be able to generate income? But I think we also have to lobby for government to expand the net. I mean, the safety nets, so that women who have lost incomes at least have something to keep them going until the situation is remedied. Thank you.
Teresa, so we are seeing an increase in domestic violence, and what some Anyarizai are talking about, increase in issues to do with child marriage. But that's the impact that you are seeing. This is the current impact. What can we do to safeguard them? How can these young girls and women access justice? You know, they're already being beaten up. How can they access justice?
Thank you very much, and thank you for allowing me to be part of this distinguished panelist. A lot has already been said, so I might find myself repeating, but there's one thing that I said I would want to just help us every time remind ourselves that we are not in normal moments. It's a different time. And also to remind us that even when we are at our best as countries, you know, like when we are not at war, we don't have a pandemic, it's highly unlikely that you have seen girls and women issues being prioritized. So when we get into a pandemic situation, it just gets worse than it is before, because the same questions we are asking about shelter homes, the same questions we are asking about justice and how the courts can respond, are the same things we struggle with every time, even before COVID-19. So with COVID-19, it just gets worse. So maybe to try and answer the question, which probably does not have an answer, Kaberi, is that, look, let me use Kenya where I am currently. You've seen that the courts, it's really been a struggle to even have human rights issues considered as priority issues or essential issues in the country, so that whether we could even have special courts to listen to these matters. And we've still not been successful. And I want to imagine that this is the same case as is for many other countries. So my proposal is that, for example, let me use sexual violence. If sexual violence happens to any girl now in any of our counties, in the villages, I can assure you with the curfew, it's so difficult to have all those things we've been teaching them. Do not shower, or please try and keep the evidence well so that we can use it. All that does not really work at this point. The best is that probably beyond this, would start asking the justice system to take cognizance of the fact that we might want to use collaborative evidence. Because if even pregnant women are having challenges to reach to the hospital for delivery, what about a girl who is trying to carry a torn dress or trying to get herself into the hospital just so that evidence of sexual violence can be taken? So I think when it comes to justice, this is really a trying time for the whole, the whole world, not only even Africa, not only Kenya. But maybe this is a time for lawyers in the house, human rights champion, girl child rights, or even children rights, to start, like some said, okay, this is happening now, but beyond, after when COVID is at the end, we should be able to have proper strategies to ask the courts to consider some of collaborative evidence. For example, if a child will be pregnant, a girl, then we should be able to use that as a collaborative evidence that sexual maybe assault happened, or any other evidence that they will have post-COVID-19. But to ask for the kind of evidence that we have been training them now might really be out of space and out of the possibilities. There are two things that I wanted just to mention about the girl child and the things that they're also going through. We've mentioned about child marriages, but I also want us to talk about child labor. You can imagine how many girls are now going to be taken to work now or employed now for cheap labor. Post-COVID-19, trying to get them out of those places they will have been posted for work, to bring them back to school, for example. So that will really be also another challenge, because it's not only child marriage that is going to happen. There's also going to be a lot of child labor, and a lot of girls will be the ones being used for this child labor. There's also trafficking of these girls, and also sexual exploitation, not necessarily in terms of forceful sex, but also survival sex or even exploitation sex, so that you're able to get maybe a living. Even small things like what you talk about, those girls who have sex so that they can afford pads, or sex so that they can even afford just their basic needs, this will really be heightened. And there'll be a lot of this form of exploitation. So at the end of the day, just being out of school for these girls has just tripled their vulnerability to all the things that we've always feared and always wanted to keep them off. So for me, I'll join the team of what next after COVID-19? How will we be able to bring them back to normalcy if there's something like that? Because as it is now, it's so hard. I'll just conclude by saying, just yesterday, I got a phone call of a lady who was supposed to be rushed to hospital, and the taxi man was saying, you know, we can't move because of curfew. And so they were asking for my advice, whether the curfew includes transporting a woman in labor. So you can only imagine if those are the things we are dealing with now. No one is really listening when we are talking about the various other issues that are happening on GBV, but we must continue talking about them so that they don't forget. Either way, as hard as it is.
Thank you, Teresa. And you talk about what needs to be done, and it still points out to the different players we have in this particular scenario. And in particular, if we look at the children with intersex and
Yes.
persons with disability,
Yes.
who is addressing their plight right now and what really needs to be done? Because it looks like we are more focused on what is being seen, people being ferried, people being quarantined, but we are forgetting these special vulnerable groups such as the intersex children and also the persons with disability. In your own view, Teresa, how do you think we should approach this issue when we are targeting these particular persons?
So again, let me use the Kenyan government experience, which is something I've also just seen in the past week. They have come out outrightly to say, even in the let me say subsidies that they are giving, they are going to have specific contributions for children with disability, the old, and also children. Intersex is a new subject still, even after the courts have made decisions on these people with human rights, just like us. But it's true that very little is still being spoken about them. But we've seen where governments are trying to say there'll be specific reference to children with disability. Unfortunately, we are again on curfew. Plus, the NGO world is the watchdog. Who will confirm that this is actually being done? When you and I are still on webinars, we can only afford Zoom meetings. Who will really confirm that this gets there? And again, it goes back to, we'll really know the great impact after COVID-19. But these are not for us to put down so that we are able to hold accountable. For those who we can via e-meetings or e-advocacy, because we can still do social media advocacy, we can still do online meetings with those who are responsible to see that they have specific directions for children, both and different, that's boys and girls, children with disability, the intersex. But at the end of the day, it will really be an issue of accountability when all this is over or about to be over.
All right, thank you, Teresa, about that. And moving on to social accountability, because we have an amazing viewership on our YouTube link that have some questions coming our way. And there's a question on how do we grow the capacity of the young people on social accountability? And Wawira, I would like to pose this to you and ask. There's so many resources that are coming our way, either at government level with well-wishers. You've even seen celebrities coming to support governments and businessmen to be able to really give enough resources to address the COVID-19 scenario. However, what do you think what kind of capacity do we need to give to our young people to be able to take advantage of these resources coming on board and, use them to ensure that there's accountability on the ground in terms of what needs to be done at community level, and also using their God-given talents and abilities to be able to support the fight against gender-based violence, the fight against, laxity with regards to protection of persons from COVID-19. Wawira, your microphone.
Sorry, yes. Juliet, thank you for your question. Before I talk about the social accountability bit of it, just as you have mentioned, there are so many resources that are out there, and we are all trying to share the different platforms that we're in. For us who are on and off in different video calls, webinars, whatever we discuss in those different platforms, you're supposed to disseminate the information to the other people who are not able to participate in such platforms, yeah? And just the same way you have mentioned, we need, especially talking about mobilizing the society, and the first, right now, media being the first platform where everybody is trying to run to, how media is, what media is talking about, what the social media people are talking about, the content creators, what are they talking about? And of course, right now, most of what they talk about is there's an increase, let's do social distancing, let's do this. And right now, the way we are increasing our conversations on gender-based violence, and we are sending out this infographics on what to do when this case occurs. But again, at the same time, as much as we are trying to push for the social accountability, we need to coordinate such responses with the service providers and the people that are actually in charge, the duty bearers. For example, there are so many cases that have been reported where people have gone and reported cases of GBV, and the police have turned them away in the name of, right now the focus is on the curfew, the focus is on other issues that are being solved. So, what do we do about such? It means there has to be that coordination of the referral pathways. We also need to talk about how do we get it to the ground, to those people who do not have access to such information. Just the same way we have been talking about the people in informal sectors, and also those in other counties that do not have strong internet or do not have access to these phones and everything, yeah? So what do we do about those people? It means we need to identify champions in those counties that have such access to information. Again, it goes back to the coordination rule. I think it was Honorable Priscilla who was talking about the COG and how we're trying to coordinate because the virus has spread all around to all counties. So that means the people that are the duty bearers that are in those counties are supposed to work with the other organizations, even if it's the CBOs or the FBOs that are there, to identify champions who are able to access such information to get it to the county level and to get it to those levels, the grassroots levels of the people who cannot access such information. And maybe just talking about other response measures would be like, the way we have been talking about hospitals and access to facilities and all that. If we coordinate, I keep on insisting on the coordination role because there are so many responses that are going on, but they're not together. People are working in silos. You get the police are being told do this, and you call 1195 and they refer you to the different service providers that you're able to get service from, but they're not cooperating. So we need to come together and push for such coordination. If it's about getting the 24-hour hospitals, which are able to give access to, to the provision of health facilities, we need to map them. We need to provide this information to the people. Right now, there's a directory that has collated, that has been done by the State Department of Gender, which has collated all this information about the, the call centers, the response numbers that people can use, but how is the coordination when it comes to going to report such cases? How are we able to get all this information if we do not coordinate such responses? So I think for us, our roles, especially for the ones you had asked about the talent bit of it, of course, it will be on how to creatively disseminate information. Is it going to be, with videos? Again, when we're talking about the champions, how are they going to in a safe way do it? Is it going to different houses and informing them about it and still maintaining the social distance? We just need to coordinate all those mechanisms from the point of reporting to the point of justice of it. Yeah.
All right, thank you so much, Wawira, on that. And there is actually a question on data there, and I would like to pose it to Commissioner Nyokabi. And in this case, we've seen a trend in reporting the cases of confirmed cases of COVID-19, obviously the people we've lost because of the virus. And there's been a question of gender disaggregated data. Is this something that needs to be done only during reporting, or can it continue beyond reporting? And what kind of infrastructure does the government need to be able to provide gender disaggregated data on gender-based violence in the country? Commissioner Nyokabi, please.
Disaggregated data. We have been able to get the data of when the minister is giving the numbers of those affected by COVID-19, they're able to give the numbers of men and women and also age disaggregation, area of county and area of residence, and even those who've been out of the country and those who are now under community transmission. I think that in fact, you know, except that this is a terrible emergency situation, the data coming out of this process is among the best data we've had in a long time. I think since the Kenya National Bureau of Statistics census, which was also gender disaggregated. I think what we are missing out is data, for example, on female-headed households. When they do the vulnerable households that they're giving welfare to, I think it would be very important for them to give us the data of how many of them are female-headed households, child-headed households. What is also happening with persons with disabilities? There was we've always had a fund for the cash transfer for the elderly, for the persons with severe disability, and also for the OVC, the orphans and vulnerable children. I think the funding for elderly and the funding for severe disability, those funds are out. The president has announced the 8.5 billion funds, but I think it is not very clear to us the data on the households, for example, or even data on the beneficiaries. For example, how many old women and how many older men are receiving the money. And we are very, very apprehensive with that fund, because even in the past, it has been a problem. It has been a source of violence for our elderly when they're receiving that money. And we are very, very worried that if the money is given without any protection, any nyumba kumi sort of support structures, that some of the people who receive the money might be in new dangers. Another area that is worrying us is the mask wearing. We don't have a clear system by government of how the masks will be distributed. So we don't know how many women will then be able to benefit from the measures and from the materials, the sanitizers, the water tanks. Because if you look at the distribution of water tanks, you see many of them in the Jua Kali centers. It's the distribution is not very clear. And I just want to point out that we have new regulations on the COVID-19 funding. The Minister of Finance has published the Public Finance Management COVID-19 fund regulations. I think we might need to look at some of those interventions and see how well do they protect GBV and gender issues. The Ministry of Health has released a sort of standard tool on healthcare on GBV. I think the challenge there is the uptake of that. And you know, our newspapers yesterday had a story on the Mathare Mental Hospital and patients not being able to go there because of COVID-19. And we are worried if the mental health is suffering and is reported, and the suffering is reported in the newspapers that that particular hospital has been closed and is no longer offering service. If it is GBV, we just don't have it reported. Maybe it is a case of all other medical services not being availed. So that question of gender disaggregated data, I think it will be important from the steering committee. Every time we have a measure, there is data on how the measure is affecting women and how the measure is affecting men and boys and women and girls on the one hand. I think we are not there yet. We are only there as far as the COVID cases are concerned, but not as far as all other measures are involved. I think that I will maybe see whether our commission could issue a letter just guiding the steering committee, because we are in one of the committees. They have created now a committee on community engagement, which has a gender subcommittee as part of the steering committee. The steering committee has 12 subcommittees. So one of the subcommittees is on community engagement and gender. So I think using that subcommittee that the Gender Commission is a member of, we might scale up this conversation on gender disaggregated data, not just on the cases, but on the measures as well. And I just to finish there, you had a good question on the best practices. When we did CSW, I think last year, because this year it couldn't happen, there was a good example from ZIM in the Women Bureau of Statistics. I think that most of our African countries are going to have to take this matter of gender disaggregated data seriously, and in our national bureaus of statistics, begin to have a very vibrant division. I get afraid myself when you say a division within the bigger unit. I think it is much better to go the Zimbabwe way and to just get a Bureau of Statistics that is dedicated to gender issues.
Thank you, Honorable Nyokabi. Now that you have mentioned ZIM, I'll go to Nyarizai. There are quite a number of questions that were sent towards you. Everybody was feeling for you because you're not able to access internet. And there's a question on how can we empower communities, into one, supporting cases of gender-based violence and rescuing girls, ensuring continuation in learning. So there's that. How can we empower communities to do that? Because right now, as it is, the community response will be the best way to beat the social impact of COVID-19. Nyarizai.
Thank you. I think COVID-19 is telling us that we need to reframe our thinking about communities so that we move beyond vulnerability to leadership, because women are on the front line. Zimbabwe, but in many countries, women are innovating within their communities. So we need to spend less money on guidelines and put more money to the actual interventions in communities. When a community is providing shelter, what they need is a minimum amount of money for guidelines. They need much more money to make sure that there's PPE, personal protective equipment at that center, to make sure that their staff are trained on COVID prevention as part of infection management, and that they are able to provide counseling, because now the counseling would be counseling for an experience of violence and counseling within a context of a health risk. So I really feel that what we need to push for is not a trickling down of resources, but we need significant resourcing support to communities. We need those women's clubs, the youth groups, the girls' clubs, all that community social protection system that exists. It needs to be enabled, to be facilitated, because that's where the solutions for Africa lies. We also know that the health system in Africa is fractured. And we know that with the COVID-19, the pressure and the ask is to do home-based isolation first before you go to the center. It means we have a combination of violence at home and also managing a risk at home, and which is associated with a lot of stigma. So I feel that the approach that we need to do is really, one, to ensure resourcing, second, communication strategies that are able to reach these communities. So for instance, a community needs a community organization needs a generator for them to be able to charge their phone, or they need some other source of energy. We need to start to talk about other issues beyond change of attitudes and beyond social norms in order for us to respond to gender-based violence, to ensure that the issues of justice are not compromised, which takes me to the comment earlier by Commissioner Nyokabi. Definitely, this is the time when we need protection of human rights most. And the state and its institutions and the ministries of justice and the police should not use COVID-19 as an excuse to undermine the level of human rights protection. It should actually be a moment when we need the highest level of support for the protection of human rights, because the right to life and the right to health is under attack. And therefore, the police, the justice system are part of the essential services in terms of gender-based violence. They need to be categorized. We know the police are essential services from enforcement of lockdown, but we also want the victim-friendly police, the victim-friendly courts, the victim-friendly systems to be part of the essential services with regards to gender-based violence in COVID-19. So it has to be the time we are also innovating with a strong referral pathway, because we have community referral systems from the individual to the police, to the court, to the social services. We actually need, this is the time, especially for Africa, to strengthen our community systems, whether it's the community system for health, the community system for social services, for policing, because whilst we are preventing gender-based violence, we are also responding to it. We are also at the same time having to prevent any risks related to infection and infection control, and to fight stigma, which is an issue we have not discussed, that the other greatest form of violence that we are seeing is stigma. And the stigma we are seeing is stigma which is way beyond what we experience with HIV. And stigma is a form of violence. And we have to say no to stigma, because the stigma is not only on the individual who is infected by coronavirus, but also to that household, which means it's to the family. And we know the caregiver within the family is the woman. So the issue of stigma for me is a gender-based violence issue, because it also means we need to integrate the responses within our empowerment approaches, but recognizing that the society, the communities themselves have solutions. We need to scale up the solutions and the innovations within communities. And it means that whole language of leave no one behind, this is the time to give it meaning, because it's not about leaving no one behind, it's about us getting out of our comfort zones and having to be on the front line where the solutions for gender-based violence and the solutions for COVID lies. It's actually a much bigger call on the elite and the privileged, much more than it is for those who are on the margins, because they are on the margins anyway. So it's a much deeper call for political leadership. It's a much deeper call for us to question even our thinking around money. We always say Africa is poor, but Africa is damn rich. We need that money we have on our continent for oil, for diamonds, for our gold, for our tourism, for all that which we have, to start to go to communities to prevent loss of life, to provide life with dignity, and to protect human rights. That, I think, is the most fundamental call that we have. Yes, we are asking the big institutions, the IMF, the World Banks, and all those whom we've borrowed from, to give debt relief. Yes, we really need moratorium, but those savings, those billions of dollars that are saved, where does it go? Does it go to address gender dimensions of COVID-19, including gender-based violence? I think that is, we need to address the issue of gender-based violence not only as a micro household community issue, but as a macro governance and economic issue, which requires political leadership and significant resources. So yes, the empowerment of communities is critical, but that calls for a much more robust leadership in order for us to protect lives and to protect dignity. Thank you.
Thank you so much, Manya Rizai. Sam, there are quite a number of questions that have been directed to you. I think you kind of opened a kind of worms of some sort. So there are questions like, how can we learn from Ebola? You know, Ebola was quote unquote an African disease, but we were able to beat it. You know, like currently we don't have any cases of Ebola across Africa. So how can we learn? And as you're tackling that, what the resources, you know, how can we, what resources do we need to be able to beat COVID? You know, from Nyarizai has already, I think, gone into details on the kind of resources Africa is endowed with. So, like, what are the resources? What other resources can we already have the knowledge from Ebola? We already beat Ebola. What other resources can we be able to beat? And I see there's another question. And then how can government raise homegrown resources in when you're investing in fighting COVID, especially for the girl child and that?
Thank you very much, Jennifer. I think I want to start off from where Nyarizai ended. And I mean, definitely, I think for a continent like ours, we don't really have any excuse to say we don't have the resources. I think probably the elephant in the room, which we don't always talk about, is the issue of corruption. And I'm sure if we are able to address the issue of corruption, then we should be able to have enough resources to be able to support our own initiative, but also our own development. The whole issue of corruption, and if you remember 2 years ago, that was the theme of the year, to address corruption, because corruption takes away from the girl and from all of us resources that needs to be invested in our well-being. So the issue of resourcing has to be taken seriously, but I think the issue of how the resources get dissipated have to be addressed. And so for me, I think when we talk about how do we get homegrown resources, it's also about how do we plug all those holes that take the money away. And I don't think it's a secret any longer. And from respective countries, we know how that money gets lost. So that is something we need to look at, and we need to address those. Now, coming back to what other resources we have, I think the resources we have in Africa is our own human resources. We have the skills, we have the expertise. Now, how do we, and I think it was mentioned earlier on, how do we coordinate all of these to make sure that the human resources we have combined with the other financial and natural resources we have is harnessed and coordinated in a way to be able to respond to not just COVID, but also to other crises, including poverty that the continent faces. So that for me is very important, and it's something that we need to look at. We also have to look at the whole issue around, now, who are we investing in? We're supposed to be investing in the younger generation. And if you go back to both the Agenda 2063, but also the SDG, it's very clear on what we need to be prioritizing. And I think sometimes what we do prioritize are not what we need in terms of moving the continent forward. So are we investing in education for young people? Are we investing in skills development for young people? Are we investing in creating opportunities for them to be part of decision-making mechanisms, which transcends just discussing a pandemic like this, but discussing general developmental issues that we face? I think it's not just enough. I think one of the issues that we always talk about is around documentation. And so if you talk about the Ebola response, yes, Africa did well, in Ebola response. But how did we document? How did we disseminate? Where is that information available? And I think if there's one thing we need to learn from the Ebola and also moving forward, is the whole issue around documentation. Is around making sure that that information is available. And we talked about gender disaggregated information, which is important in our response. I think most of the responses we see, Honorable President mentioned that it's wholesale and it's gender blind because it's one intervention fit for everybody else. And I think what we need to be looking at is making sure that we are documenting all the successes, but also the failures, and how to be able to use that lesson in responding in the future. I think the whole issue of accountability that's coming, our accountability mechanism, I'm not sure where it starts and where it ends, and if we want to be a continent that is learning and that uses that learning to be able to respond in the future, then we need to strengthen our accountability mechanism. So for me, it's also important that we have mechanisms that hold ourselves accountable. And it's not just our leadership, but also all of us as citizens. I mean, how do we hold ourselves accountable to resources that we have, I mean, to expertise that we have? I think in terms of how do we bring all of this together, I mean, from a continental level, I think the AU has a big role to play. The regional economic blocks have roles to play. But as I said, we need to frame a political and a legislative framework which is able to make sure that the learning, the resourcing, the people around all the discussion do work in some unison, but also recognizing diversity, which brings about the richness in responding to these issues. I think one area that we haven't talked about, and which also links to the whole issue of resourcing, has to do with girls in emergency situations. I think that is one area that and especially with the lockdown, we've seen a lot of NGOs who work in those areas, I mean, moving out. So that is one area we need to look at. How are we resourcing and responding adequately to girls and adolescents in emergency situations? Because it's not just an emergency, it's also life-threatening in some cases. It's about the future of young people, and if for all the stress they are going through, I mean, for all the psychosocial challenges they are going through, if these are not addressed, then what we're also going to find out is going to find a society that is bruised after the COVID. So again, how do we mobilize ourselves to respond, not just in the immediate needs of our people, but also in the mental health and making sure that by the time we are done with COVID, we don't have another crisis on our hands. We have to do with how do we address the bruises and the impact which girls and young people and women would have gone through.
Thank you, Sam. Teresa, so how do we make communities, fight how can we sensitize communities to fight GBV in this space? And as you're talking about that, I would have loved Sam to talk about this, but about how can we involve men? Men, I think Sam, you can start, and then Teresa can jump in about sensitization. How do we make other men be like you? The he for she. You can see you're the only man in this panel. So how can we make more he for she's? And then Teresa, jump in. How can we make communities sensitize them? Because everybody right now is talking about COVID. Wake up, Twitter, everywhere it's COVID. But people are not talking a lot about GBV.
I mean, if you talk to every man, I will tell you they love their mothers, they love their daughters, and they love their wives. And I think the issue of gender is neither nor. I think we need both men and women to be able to address gender-based violence. I mean, the majority of incidences of gender-based violence is meted by men on women. So for me, what we need to look at is right from parenting. I think parenting plays a key role in trying to address some of the socialization that we have in the communities. And I think if parents would look at gender as both something that both men and women will have to be doing, I think that for me is key. And we need the whole discussion around champions. I think we need some men champions. And I believe there are a lot of them. The point is, how do we identify them, and how do we involve them in issues that go to the core of gender-based violence? We also have to look at the boy child. I know we've been focusing a lot on the girl child. That doesn't exclude the boy child. And for other organizations working with girls, I think the conversation has always been how do we work with both men and women to address the issue of gender inequality. So that is very key, but I don't think we have shortage of men. I think it's just making sure that the men do understand the impact of gender-based violence on women. And if men always say they love their children, they love their daughters and like their mothers, then we need to challenge them to be able to go an extra mile in making sure that we are at the forefront of fighting gender-based violence. But again, we are also holding other men accountable if we see that they are not doing what they are supposed to be doing. We need to strengthen the laws to make sure that the laws do address and arrest gender-based violence. Sometimes I think the law is a bit lenient, and like I said earlier on, it's also because we are not resourcing law enforcement agencies. But definitely, we need to be talking amongst ourselves as men, and I think we do some of those things around our office, trying to look at the general conversations on how we can bring men to the table to address and also to champion issues of violence against women, especially. Thank you.
Teresa, I think you jump in from a woman perspective. How can we make men our champions, as Sam has said, and also sensitizing them on issues to do with GBV
I usually go a slightly different direction where, yes, I agree with Sam that men should look at us as their mothers, their sisters, or their wives. But I just go to the fact that just look at women and girls as human beings, as fellow human beings, because at the same time, not many of the women can fall into the various categories, but just to look at them as human beings, as fellow human beings. How do we get them to champion for these rights? One of the things is that just for them to be sensitized that with time tables could change, and this is not a feeling they would want also to have on their side. So what can they do so that we just have a balanced situation for both men and women, girls and boys in the society? So for me, it's just to champion the idea that we are all human, just as human beings, just the way they would treat their fellow man. I'm sure they don't go around just hitting their fellow men or hurting their fellow men, but just to tell them that they are just human, just like you treat your other male counterparts. So it's just reciprocating the same. But to go back to the question on how can we sensitize communities, I'll start again where I started from the last time, that these are odd times. These are difficult times, and so many things, so many people are going to take advantage of the situation to do horrible things against each one of us or everyone in the community. I mean, when it comes to sexual violence, it's not a preserve of women only. There are even boys who may be defiled, or even men who may experience sexual violence. So what we need to do is continuous education, just like Sam said at some point, that at the end of the day, the fact that we have COVID-19 doesn't mean the rest of our lives has stopped. So many things will still continue. So just to keep alerting the communities that violence has not stopped. If anything, it's going to heighten. So call upon communities to increase their security, how would I put it, their security strategies that they've had, because even before COVID-19, we had Nyumba Kumi, we had community watch, we had so many other strategies. So that's to heighten those strategies. And also to remember that this is a temporary situation, but with very dire consequences. So as much as we can remind ourselves that we are better off protecting any violence now than dealing with it later. So then communities can also be engaged in that sense. So as we continue speaking about COVID, in the same breath, we speak about gender-based violence in our communities and how we can protect the same. One last thing that I wouldn't want societies to forget is that at least with criminal matters, there's never an end to the timing. You know, like in civil matters, you can say you can only sue someone after 1 year or 2 years when the matter happened. But with criminal offenses, it's open-ended. So we will need people to be resilient, keep evidence that you can, keep information that you can, and when things will be calm enough, then we should still be able to use those evidence against the people who have committed violence against each other. And here I really still emphasize that I've already experienced that there is so much priority being given on COVID-19 that some of these cases being reported at the police station, you're actually told to come back later. The police vehicles are not available. They've gone for a response somewhere else, or all of them are at roadblocks, preventing people from moving. So the best you can do is to report, and have that report, keep it safely, because after this, we can still be able to pursue justice for those who would have experienced GBV.
So, Teresa, your last point, and it should be a call to action. This is for everyone. Your last comment and a call to action. What needs to be done during this season to end gender-based violence? As you go that, and then Wawera, and then Nyarizai, and then Sam, and then I don't know if the commission is still with us, and then we can end.
So my call to action is this: that we must speak. Immediately you mentioned COVID-19, please, in the same breath, mention gender-based violence, and let people know that this is something that will increase with the process of protecting ourselves from COVID-19. Gender-based violence is increasing. So in the same breath, we talk about COVID. In the same breath, we should also severally, as many times as we can, mention also gender-based violence, and tell people that if it happens, like I said, you need to be able, if you can report, depending, because I'm not saying all places have complete lockdown that you cannot, but at the same time, we should be able to be resilient and persevere when time comes to seek for justice.
Wawera?
Thank you so much for engaging us in this conversation. We look forward to more conversations like this one. My last call for action would be, we need to really enhance the referral pathways. We need to protect, we need to prevent, and we need to respond. That would be my last call of action. So let's enhance the shelters, let's enhance the health response, let's enhance the online counseling, the psychosocial support. That whole referral pathway needs to be really enhanced and worked on, especially during this period.
Yes. Nyarizai, she's still with us. Nyarizai?
Yes, my last word is a call out to each one of us as citizens around the world to be responsible, to respect the human rights of the other, to resolve with all what we have in order to prevent gender-based violence, and to offer support to those who are experiencing gender-based violence. It's not justified. Gender-based violence, COVID-19 should never justify gender-based violence. It's not justified in any circumstances, and it is criminal. So no to gender-based violence is not child marriage.
Okay, thank you. Sam?
Thank you, Jennifer. I think I would want to reiterate what has been said earlier on. I mean, response to gender-based violence shouldn't stop because we are in a situation where everything seems to have been drawn to COVID. I think we need to intensify our response to gender-based violence, because it's not only because of COVID. I think we need to strengthen law enforcement and making sure, like Teresa said, that the law takes its course. We need to make sure that we are raising awareness to community members. There are a lot of opportunities to use this radio, there are TVs, and there are other platforms. But I think we need to continuously stress the fact that response to gender-based violence doesn't cease because we are addressing COVID. If anything, just like Teresa said, I think we need to make sure that now that we know that the incidence is going to increase, we need to intensify our response as well. Secondly, we need to resource responses. And I think organizations like Plan, Fawe, and others should also be investing in making sure that we are responding adequately to gender-based violence in our communities.
Juliet, your last word, my co-presenter.
Sorry?
Inter-age responses towards because realize gender-based violence is not only being experienced at home. Well, home is now like the epicenter of GBV during this COVID-19 days. But beyond even the household setup, we are seeing increased cases in learning environments, in other community setups environment, and it's up to really us as stakeholders in ensuring that the rights of the vulnerable groups are upheld, to play a role as individuals, as communities, as groups, and ensure that there is the right legal work to actually counter perpetrators of gender-based violence. Is a sustainability plan to ensure that both in times of crisis, in pandemics like this, and without crisis, we have a reference point to really beat the vice in our society. That would be my call to action. And thank you so much to all panelists for such an informative session.
Okay, I've seen Honorable Nyakabi, you're back, right? Your last words as we finalize.
Yeah, thanks a lot. Just, I left the part about lessons for Africa, and that would be my last word, that we have to learn lessons from this pandemic and from other pandemics that we've had. I like the conversation we had earlier, I think Nyaradzai or somebody mentioned about Ebola. And in terms of learning questions, I just have put it into 4 points. One is the health systems. Our health systems are very, very weak, normally and ordinarily. I think it is time that the African leaders put a lot of emphasis on strengthening our health systems all the time, that we have strong, working, functional health systems, and that we put resources in health systems. And I'm hoping that the country, Kenya here, learns that lesson. Treating health workers with a lot of respect. We have a big conversation on the Health Service Commission, creating a commission for health workers, just like what we have with the Teacher Service Commission, with the Police Service Commission, with the Judicial Service Commission. I'm hoping that the country will give a reward to health workers who are our frontline ambassadors in terms of creating a Health Service Commission. And I've served in Parliament. You'll be amazed at how difficult it is to have a health conversation in our legislatures, to have reforms around the health systems in our legislatures. So I'm hoping that COVID-19 allows us to do that. ICT and continued use of ICT. In fact, my fear has been, here in Kenya, women even hardly access information generally. There is more information to men than there is information to women. And even our tools of information are in the hands of men. If you look at ICT, for example, our ICT sector is male dominated. I think it is time that the ICT sector, now that we are using ICT for our work and for all other purposes, even GBV, reporting for GBV ought now to be ICT centered, that we have police centers and the occurrence books that are able to take on GBV cases through ICT. And then the local resources question, local manufacturing, that those are also gender nuanced. Both men and women need to be part of the battle for COVID. And lastly, that gender equality is then something that we in Africa are able to promote. But I'm hoping that we learn lessons. One of the saddest things with Africa is the failure to learn lessons. I'm hoping that now with COVID-19, we learn the lessons, we strengthen the systems, and we are able to see better days ahead and to be better prepared for such eventualities. Thank you very much, and thank you for the conversation. We at the Gender Commission are happy to have been part of it, and thank you for the panelists as well.
Thank you everyone for joining us. I really do appreciate all of you coming in. Nyarizai with your phone, thank you so much. We really appreciate from Zim. Honorable Nyakabi, I know you are busy in between meetings. Teresa, thank you for.
The worst now for me is the curfew.
Oh yeah, you're running away from the curfew. I hope you beat it, you know. Well, thank you for bringing the youth perspective. You know, you should go to the YouTube and you see all the youth telling you thank you for speaking for us. And Sam, thank you. I hope I didn't wake you up again. Thank you for coming in and and just and conversing. I know it is quite early, but thank you so much for joining. My co-presenter Juliet, asante sana. You know, we are this together. Thank you so much, and join us again anyone for another conversation on how can we ensure that we come out better. You know, we're not going back to normal, but we're going to come out better from COVID-19. Thank you so much, and God bless you.
where's my Sprite? Found it.
Okay,
For all those
bye-bye.
asking,
Thank
and
you.
thank you for little
Thank you,
Jonah.
Jennifer.
We appreciate. Yeah, thank you so much.
Thank you.
Okay,
This
thank you.
video will be
Bye-bye.
Thank
available on
you.
YouTube for all those who are asking. Thank you so much.
Thank you.
Bye.
Bye.
Bye-bye.
Bye.